RetinaRounds, episode number 138, Gene Therapy for Neovascular AMD. A number of promising clinical trials are underway investigating gene therapy for the treatment of neovascular AMD, and it could very well be the way in which we treat this disease in the future. Basically, a viral vector is used to deliver a gene encoding an anti-VEGF molecule, thereby making the target cell a biofactory for anti-VEGF medication. There are a number of ways by which the gene can be delivered, including subretinal, suprachoroidal, and intravitreal strategies. In today's video, guest surgeon of the week, Dr. Michael Klufas, will demonstrate the subretinal and suprachoroidal delivery of investigational RGX-314, or sura-vec, which is a gene therapy delivered via an AAV8 viral vector. Let's check it out, and if you haven't already, be sure to watch our interview with Dr. Klufas in podcast 22, where he talks about how to assess and get involved in clinical trials. Okay, getting started at the beginning of the case, you can see here that Dr. Klufas is starting with a core vitrectomy, and now he's carrying out a peripheral shave. Some triamcinolone is instilled into the vitreous cavity just to stain for any residual hyaloid, and you can see here that the PVD has already been induced. And now he's going to go around with the assistance of scleral depression and performed a shaving of the vitreous base. You can see a small retinal break that's here, and that's going to be lasered. All right, so now we're going to take a look at this special handpiece. This is a 23 gauge instrument with a 41 gauge extendable subretinal cannula, and you can see that one of the trocars is a 23 gauge trocar to accommodate this handpiece. So this is a hybrid vitrectomy setup. The vitrectomy is performed using 25 gauge instrumentation, and then this 23 gauge trocar is used for the subretinal delivery. So now this extendable subretinal cannula is introduced into the infranasal quadrant, and so the decision for where to inject this is intentional. There are some pigmentary changes that can occur with this particular investigational product, and so the goal here is to inject this inferiorly and away from the macula. The nasal RPE actually is a little bit more dense than the temporal RPE, and so Dr. Klufas is going to start here in that infranasal quadrant, but he's not quite happy with the way that the bleb is elevating here, and so he's going to go into a separate location now in the infratemporal quadrant, and you can see this subretinal bleb that's being elevated. So he is actually bringing that subretinal cannula right up to the surface of the retina, and then beginning his injection, and then very slightly dimpling the retinal surface until that subretinal bleb is created. Now, a couple of things to look out for while the bleb is being created. First, you want to make sure that it's not expanding towards the macula. If that happens, you do want to go into a different location. And then the second is that you do want to make sure that the investigational product isn't refluxing into the vitreous cavity. There will be a little bit that might reflux, but you don't want excessive amounts of that investigational product egressing from the desired subretinal space. Now, an air fluid exchange is being performed, and that's really intended to remove any refluxed investigational product. Some subconjunctival antibiotics are injected, as well as a subtenon's Kenalog injection. All right, so here's another strategy for delivering the medication. This is a thermal camera, and the investigational product is cold. So you will see this expansile blue dot, and so that is the investigational product that is being delivered into the suprachoroidal space. So let's watch that one more time. Again, you're looking for this expansile blue area. That is the investigational product, and you can see that being effectively delivered into the suprachoroidal space. The advantage here is that this can be done, obviously, in an outpatient setting without a trip to the operating room. Okay, so here's some discussion points. The holy grail for gene therapy is that it may serve as a one-time treatment for neovascular AMD and other conditions like diabetic macular edema, providing a sustained long-term delivery or production of anti-VEGF molecules. Now, there are three ways by which gene therapy can be administered. One is through an intravitreal injection, where the viral vector carrying the desired gene is injected into the vitreous cavity, similar to a standard intravitreal injection. Certainly is very easy to integrate in an outpatient clinic workflow. However, it may carry a higher risk of intraocular inflammation and is less targeted to specific cells of the retina, and therefore may be less efficient since the gene therapy is not being directly delivered to the target RPE cells. The second method is with the suprachoroidal injection, which is a technique that will be familiar to those who perform suprachoroidal steroid injections. This method is also easy to integrate into a regular outpatient workflow, although delivery into the suprachoroidal space can be technically a little bit more challenging in some eyes and can potentially be less consistent with respect to getting a pre-specified volume into the suprachoroidal space. Also, while this strategy does target the sub-RPE space, it is a higher flow vascular space that is not immune privileged, and therefore inflammatory reactions are possible. The last method is subretinal gene therapy, whereby the vector is injected directly into the subretinal space following a vitrectomy. And this allows for a more targeted and efficient delivery of the desired vector, but of course is the most invasive, requiring surgery and special training. Now, while the injection is still within an immune-privileged space, immune responses are still possible. So we'll be eagerly anticipating the results of upcoming gene therapy clinical trials, and we want to thank Dr. Klufas for giving us a peek into what could be the future of neovascular AMD treatment. If you enjoyed this video, please visit us at RetinaRounds.com. There you can sign up for our email list. You'll get a notification every time a new video is posted. And if you have an interesting video or a tip or trick that you'd like to share, please follow the links on our website and you can upload your video there. Thanks so much for watching.